The following segment is sponsored by Northern Nevada Health System.
We're at the Northern Nevada Health System with Nicole Schultz, who is a certified physician assistant, talking about headaches.
Yes.
Not just parents get these, Nicole, okay? Take it from me. Are they migraine headaches or headaches and migraines? How do you classify these things? What's the difference?
Yes, so there are some major differences between the two. Migraine headaches, they're typically one-sided. They are associated with nausea, vomiting, sensitivity to lights, sounds, smells, stuff like that. They're usually more severe compared to a tension-type headache, which occurs on both sides of your head. People typically describe that as a band tightening around their forehead. It can still be pretty painful, but not as bad as a migraine typically.
So when do you know if you need to come in and get help?
Yeah, so obviously there are warning signs of something that could be much worse than a migraine or a tension type headache, and that would be something like the worst headache of your life. So I recommend going to an ER for that. But for regular old migraine and tension type headaches, if you're feeling like you're having a lot of headaches and you can't work or function as a result, I would go talk to your PCP.
So if it's debilitating, you can't even get out of bed.
Oh yes, that is not good, and you should come and talk to one of us about that.
So treatment options.
Yeah.
If it's not that severe, what can you do at home to alleviate this?
Yeah, so it's pretty easy at first. You start with over-the-counter pain medications like ibuprofen, Tylenol, Excedrin, migraine. If that doesn't work, we have a lot of prescription strength medications, and that's something we would talk about during your visit.
More women or men afflicted by migraines?
Typically, it's more women. There's a lot of triggers for migraine headaches, and one of them is actually changes in your hormone levels, which women go through monthly.
So that's a common trigger. And
That
then
is.
the bright lights and the other things you mentioned can exacerbate it.
Actually, the number one trigger, which I think a lot of people can relate to, is increased stress. That is something that can cause a really bad migraine headache.
Back to the whole parent issue,
Exactly.
right, Nicole? No. Thank you so much. I appreciate
You're
that.
welcome.
And if you want more information on this, just go to our website, foxreno.com.